Are you like me that do not go to the hospital like before nursing school? Like anytime I'm sick, I just go to the pharmacy shop, and I always get sick of malaria, so I know only anti-malaria drugs. Or are you like me that people around you that are also nursing students know about drugs, and anytime they are talking about drugs, you are always like, now two of us did this nursing school. You are always asking yourself if all of you are in nursing school. Are you like that? Or are you like me that did not work in a pharmacy shop before coming to nursing school? If you're like me, I got you covered on this one. I am here to tell you how to get familiar with those drugs, how to start as a nursing student. It starts from now, especially in your year 2. It's not just being in year 2, but you can start immediately. You start going for clinical postings, okay? Hey, welcome back to my channel. As you can see, I came with the energy. As you can see, I came with all the energy I need, okay? So I came here prepared. As you see me with my jotter, I came here prepared. I've written things so that I'll go in order, okay? So guys, my name is Joy, and I'm a year 2 nursing student here in Nigeria. And on this channel, we just do everything nursing. Just go down to the channel, you will see 1 or 2 videos that will interest you. And please pardon me, there's a fan here. Pardon the noise, the vroom from the fan and everything. So in today's video, I'll just be I'll be giving you some tips on, how to get familiar with your drugs. You know that when you get home and your compound people or your neighbors know that you're a nursing student, they will come in one way or the other. They will come and ask you, Joy, say you don't go nursing school. Abeg, I get this problem, I get that problem. That's the time that they will bring all their problems to you, and you do not want to fall your hand. That is why you are watching this video. Please share this video to other nursing students that needs it. Please, when you get this video, you watch it, please share it to other people that needs it, okay? Thank you so much. So you do not want to fall your hand, at least you want to have something to use and answer them. Or as a nursing student, you can be asked any question at any time and anywhere. Somebody that knows you as a nurse can call you and ask you stuff. And when you're putting on your uniform, you can be seen by anybody and you will be asked any question. So in today's video, I talked about this thing, and this is something I've been doing for some time. So I was like, why not? Let me come here and share this with you guys. School, in nursing school, we do have 2 sections, like the theoretical part and the practical aspect, okay? The practical aspect is when you will be in a clinical setting. That's when you will be in the hospital. While the theoretical aspect is when you will be in the class and when you will be writing your exams and all of that. As a nursing student, you do have access to patient case notes, but let me remind you, there is confidentiality in nursing. So what I do is, after the things we do when we go to the ward posting, after greeting your matrons and your classmates and all of that, then you read the report of if you are in morning duty, you will read the report of yesterday's evening and night duty to get a clear view of what has happened after your shifts. And after reading that, when it's time for medication, you go to serve medications, and if there is wound dressing to do, you go to do the wound dressing and all of that, depending on the kind of ward you are in, okay? So I just want you guys to make good use of your time, okay? Make good use of your time, because after nursing school, boom, you are exposed to the real reality. You are exposed to the real nursing, okay? So as you can see, I have a book here, like I said, and I'm just going to be telling you guys some things from what I wrote. Okay, like I said, if you're usually exposed to the clinical area, get a jotter and a pen. These two things, you should not lack these two things. Okay, get it. And after your routine you do in the hospital, you have access to patient case note. Take patient's case note, leave their names, okay, because there is confidentiality in nursing. Leave their names, go to their diagnosis, check what they've been diagnosed of. Okay, what have they been diagnosed of? You write it. What drugs was prescribed? What investigations were they told to do? When you are writing the, okay, for the sake of this video now, we'll be talking about just the medication. After you've written the medication prescribed, you write it completely. Like you write, if it's email, you write injection email for 3 days, then 150 milligram 3 days. You write it completely. After writing it completely, you are going to, go and Google that drugs on your own. It is part of the learning. When you Google that drugs on your own, you'll be able to, get more information about that drug. And it's not just going to be email. Maybe they give the person something else, injection PCM or any other medication. Just Google about the medication. Is it Flagy, IV Flagy? Just Google about it. What is it used for? Their mode of action, their dosage for adults, everything. Just Google everything. Write it down. Google and write. As a nursing student, Google is your best friend. Okay, so you write everything, and from time to time you review it. From time to time you review it. I'm not a very big fan of reviewing it, but from time to time you have to review it. You just have to review what you've written. So the next thing is that you can also do some mind quiz. When I talk about mind quiz, maybe you have written these drugs and you've written it, and you want to just remind yourself. Okay, you know it, but you want to remind yourself about it. You can just say, which dosage is this medication? Which dosage is this medication? You try to remember it on your own. If you cannot remember, then you go back to your book, your jotter, where you usually write all these things. You go back to it, and the next thing is ask questions. When you are in the clinical posting, ask questions. Ask, okay, why did you prescribe this instead of this? There are some drugs that they don't give to a patient. Okay, let me explain better. Two patients have the same diagnosis. Let me say, for example, two patients have pain. Two patients have pain, and they can give ibuprofen as a pain relief to one patient and not the other, and they will now give, let's say, tramadol to the other patient. These people are having pain. I'm just using this as an example. These two people are having pain, but why do they give one ibuprofen? Maybe the one they gave tramadol has ulcer, and ibuprofen is going to trigger it. Okay, you have to ask questions. Ask a lot of questions. Something happened. A guy was having malaria while I was in the ward, and as he was having malaria, he was PCV. That's the level of blood he has was about 20%, and he needed to be given blood. So they suspended the malaria medicine to give him blood first. And while they were giving him blood, I saw on the drug chart that he has to have some things there. He has to have furosemide. He has to have hydrocortisone. Hydrocortisone is for reaction. Furosemide is to kind of flush the system. The blood is going to the heart, so it's to flush it first. And after giving the blood, they will also give furosemide again. So I needed to ask questions. Why is this happening? Why is that happening? Okay, so you need to ask a lot of questions. ask a lot of questions as you are in nursing school. Ask a lot, okay? Yeah. And the next thing you should do is, whenever you are in the clinical posting and you want to give patient an injection, let me say you want to give patient ceftriaxone. When you withdraw the ceftriaxone, and you know that if you want to give IV, you mix the ceftriaxone, the powder in the vial, you mix it with sterile water, with the injection water for IV. While if you want to give IM, you are going to use lidocaine. After mixing it, I'm not here to teach you drug anyway. After mixing it and giving to the patient, rather than just throwing the pack and everything, you can take the leaflet out of it and study it. But if you do not want to do that, you can also get a drug book. Get a drug book, drug book, drug book, drug book. Get a drug book. And it's not just about getting it. Me, I'm guilty of this one. It's not just about getting it, it's about studying it, okay? Also study it, okay? Study, 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 and study, okay? Study no dey finish, okay? Study no dey finish. And I will recommend one drug book, which is the one I use, the drug book that I use and I recommend. It is not sponsored. I wish it was. And this is the Index Drug Information Book. And if you do not know where to get this book from and you are interested and you are in Nigeria, please hit me up on Instagram. My Instagram handle will be on the screen. Just hit me up if you are interested and you don't know where to get it. But if you know where to get it, go ahead and get it. It is really good. They tell you nursing consideration, the dosage, the pharmacovigilance. They tell you everything. And yeah, they also have this index. They also have an app that you can download on your phone, and download it, sign in, and you can have access to it, okay? So you can just go to the content of this book and you see it: disease affecting the gastrointestinal tract, disease affecting this, disease affecting that, and you see the conditions. You can just go direct and search for what you want to search. There is drug, so they have drug use in pregnancy and all of that. So you can just also download it on your phone if you cannot get this, okay? So yes guys, and yeah, so guys, if you totally enjoyed today's video, please give me a thumbs up and make sure to subscribe to the channel. Share my video, share, okay? Please share my video. If you haven't subscribed, please make sure to subscribe just below, okay? Just subscribe, and I'll see you guys in my next video. Also feel free to leave video ideas you are interested in, maybe videos you want me to do. Leave it in the comment section. Make sure you check out my other videos. I've put them in a playlist so that it will be easy to search for any video you want, okay? So guys, thank you so much for watching. More videos coming your way. Take care. Bye.